Hi, this is Stephen Frizocco. I'm Chief of the Emergency Surgical Service at Brigham and Women's Hospital in Boston. I'll be spending the afternoon discussing four broad areas of emergency surgery and emergency surgery topics and how they relate to standards of care. With the management of these wide variety of surgical emergencies, detailed algorithms will be gone over regarding standard of care in terms of workup, diagnostic tests, as well as any surgical interventions which are necessary will be gone over in great detail. In addition, we'll be focusing a significant portion of time regarding keeping adequate and detailed medical records as well as deviations from the standard of care with regards to documentation of adverse events as well as documentation of complications and procedures. The first subject that we'll be discussing will be the management of acute cholecystitis as well as complications and pitfalls of laparoscopic cholecystectomy. Cholecystectomy tends to be one of the most common surgical procedures performed in this country, and we will go over in-depth indications for the procedure as well as common pitfalls and complications and management of those complications with regard to standard of care. Next topic will be the workup of the trauma patient. In this country, trauma accounts for a significant portion of death as well as significant morbidity and mortality. In this talk, we'll be focusing on appropriate management of a trauma patient, both at a level 1, 2, and 3 trauma center, indications for workup and management of the trauma patient, realization of when to transfer a trauma patient, as well as the management and workup of the missed injury, a very common occurrence in the workup of trauma patients. The third topic will be the workup and management of the acute abdomen with respect to an emergency room visit. The acute abdomen represents a wide, ever-changing complex of syndromes and disease processes which affect patients throughout all their age groups, both male and females. Common workups and managements, as well as standard of care for various surgical disease processes will be discussed. Finally, the topic of vascular emergencies will be gone into greater detail. These include management and workup of aneurysms, both abdominal aortic as well as thoracic aneurysms, as well as other vascular emergencies such as deep venous thrombosis and pulmonary embolisms.